I've been dancing my whole life. I have a dance studio in Brooklyn. It's just been a part of my life since day one. It was like breathing. I had acid reflux before it was fashionable. I lost my voice every spring. I had no voice. And it was a combination of allergies and this reflux. So to speak and to teach was really difficult. It hurt. By the time I'm teaching the 4th class, I have to push my voice, and it just made me a less patient teacher. And I put up with that for many years. And finally, I was lucky enough to find Dr. Al-Turki.
Fundoplication surgery is recommended when acid reflux really interferes with your daily life. We freed up the top part of her stomach and we wrapped it around the bottom of her esophagus and tightened it down just the right amount so that it could prevent acid from backing up without obstructing her ability to eat.
I had the fundoplication, and I had 5 wonderful years of being able to speak without it hurting. It was heaven for 5 years. And then I was taking a yoga class and I came out of it. And I felt like I had pulled a muscle. So I'm like, okay, well, if I pulled a muscle, it's a weird place to pull a muscle, but you're getting old, so it'll get better. And then it didn't, and it got worse. I called first thing in the morning and they said, come in right now. And I had a CAT scan that day.
I did an endoscopy and found that at the very bottom end of the esophagus, there was a small nodule, and we biopsied that, and to my surprise, it was cancer of the esophagus. I
felt like a lightning bolt went through me. And his mouth is moving. I don't know what he's saying, because I just went into this other place. When I walked out of the hospital, I felt like my feet weren't on the ground.
It's a very complex operation to remove the esophagus. The esophagus sits deeply in your chest cavity. We went in and we removed the area where the cancer growth was with a good, what we call margin on either side, because sometimes it seems normal, but there are cancer cells that sort of are invisible. So we took that with a margin up and down, and then we moved the whole stomach up, and the two come together somewhere in the upper chest.
Dr. Al-Turki came out very optimistic. He says, I got it all. You know, it's fine. Everything's going to be great.
She's been in remission now for 5.5 years, so she's been doing great, and I'm extremely confident that she's cured from this disease. I think the great excitement on the horizon is the introduction of immunotherapy into the treatment of esophageal cancer, and we have taken steps into getting a trial here where patients are given immunotherapy prior to advanced stage disease and prior being treated surgically. And we're looking forward to seeing how this actually improves the outcomes for patients.
The most rewarding thing about teaching dance is when my ex-students come with their child and they hand their child over to me to teach. It's the ultimate compliment.
Are you ready? Are you ready? Okay, let's go. Get down to business.
I can't dance as long as I used to, but it's still improving. Just keep putting one foot in front of the other.
2, 3, brush it back, step side, step front. And 1,